Thank you, Katie, Kevin, and Nolan. It is really hard as an economist to not be on a panel of economists because you're sitting there in the chair going, but this, and this, and this, and this. So in this moment where we're moving around, hey, we're all adults. Like if you need coffee in between sessions, grab a coffee, bio breaks, go for it. But what I would like to ask you to do as we set up for the next session is to turn to your neighbor and tell them what struck you the most. What are you taking away from that session? Okay, so one of the things about our brains is that when we talk about what we've learned, when we write down what we've learned, it stays in our brains better. So please, in this moment, turn to your neighbor and say, it was that thing, right? For me, it was walking back in and hearing Nolan say that to meet that 7% threshold, a family has to make $190-something thousand a year. Like, whoa, right? That is a fact that is gonna stick with me. All right, so we're going to move on to our second session. So Thread hosts this summit event every other year, and what's turned into a great tradition. The great thing is that we're filling these rooms. We have a standing agenda item is to shine a light on the bright spots across our state and elsewhere where positive early childhood investments are being made. These examples have inspired creative change over the years, including after our very first summit of 2015, where Thread was inspired by a panel of businesses featured for family-friendly benefits. Following the summit, Thread was inspired to strengthen its family-friendly culture and implemented paid parental leave and bring your baby to work policy. We hope you're inspired with that change too. With our next session, for this session, we will have a Q&A following the presentations. So instead of note cards, we want to hear from you, and you'll have the opportunity to come up to some standing microphones that we'll set up. So think about those questions and comments as we listen to this panel. So in our next panel, we'll be transforming the future. This year, we have an awesome panel of local and state leaders who are shaping their communities. And to moderate this session, we have Olivia Foster. Olivia is a fellow board member at Thread. She's also my replacement as treasurer. So I'm so happy to have her take over the treasurer role after 4 or 5 years of being the treasurer. Thank you, Olivia. She is a registered nurse for Providence Valdez Medical Center, where she's in charge of infection control and education, something that keeps her busy. Olivia is also a city council member for the city of Valdez. So clearly she has a diminishing resource of free time between all of these things. Welcome, Olivia and panelists.
Thank you so much, Jonathan, and welcome everyone. This is so exciting to actually see people's faces in person. Being in Valdez, we get some snow, we get some rain. Some days the sun comes out, so it's just such a blessing to be up here with all of you. And I welcome you all to Valdez. Anytime you want to come down and see us, it's a beautiful city and we're really nice, but we have no childcare, so. Real treat today as we have real change makers right here sitting next to me on this stage, local and state leaders who are transforming childcare and here to share with us about how they're doing and what they're doing at the local level are Eric Croft. Eric Croft is an assistant professor in legal studies at the University of Alaska. Casey Warner, program director for Hyper in Seward, and Robert Barr, Deputy City Manager of the City and Borough of Juneau. And Robert is also a fellow board member of Thread. And to share how they're working for transformation at the state level are Alaska State Representative Julie Colomb. Yes, I got it correct. Okay, Sarah Mickelson, Deputy Cabinet Secretary for the State of New Mexico Early Childhood Education and Care Department. Welcome to Alaska. And thank you all for being here. And I'd just like to give them a round of applause for making the trip.
I'm not applauding now.
So I'll start by asking you all to share your story about how you and your community or state are working to transform childcare. Each of you will have about 5 minutes to share, and then we'll spend time in a discussion. So for this session, as Jonathan said, after our panelists share, we'd love to hear your voices too. So we have a microphone that is available for everyone to ask questions. So if you have any burning questions as you're sitting at your table, please do not be shy. Write it down on a little note card and pass it up front here, and we'll make sure that the panelists listen and try to answer your questions. We're going to come up with solutions today, and oftentimes questions are what instigate the thought process and creativity around these solutions. So let's start with Eric. Please share with us about the municipality of Anchorage, Proposition 14.
Yeah, stay here or go up there?
Oh, you can stay there.
Great, thank you. Stephanie told us that we have a very strict 5-minute limit and that we had no slides rule, though I noticed the cabal got to use slides. Katie and Nolan got to use slides. But so I want to very quickly tell you about Prop 14 and then more importantly, I think the guiding principles that we used to get there. In a nutshell, this April, Anchorage voters approved pretty overwhelmingly, 56-44, so that's a big win in politics, the dedication of the Anchorage marijuana tax to early childhood education, child care and pre-K education. Yeah. We in this city have spent a little over $100 million every year on marijuana products. And the tax currently is set at 5%, and so it raises a little more than $5 million, between $5 and $6 million a year. That's going to start to go into that dedicated fund January 1 of next year, and by midsummer, by June, July, there'll be an advisory board. That was part of what we put together that will advise the assembly and the mayor on how to spend that money. But that'll be that $5 to $6 million going every year for it. The charter amendment was intentionally built with broad flexibility about how the money could be spent, direct grants to providers, training of staff, facilities, retention, insurance pooling, fundamental research, all of that is on the table. We intentionally made it broad. We're currently working on enabling legislation and on a research and information gathering process to enable the new advisory board to hit the ground running. That effort is being led by former Mayor Austin Quinn Davidson. So if you have questions later, you can send that to me, to her. We're putting that together. That's what we did. But more important in the limited time I have, thank you, Stephanie, is I want to hit the 4 core principles that we used and maybe as a guide for other efforts. And those are dedicate the money, trust the people, go where the kids are, and build a broad coalition. 4. Should usually have 3, but it seemed like it was 4 here. First, dedicate the money. Secure adequate, reliable funding outside of the annual appropriations process. Early on, we concluded that the appropriations process at the federal, state, and local level just wasn't built for long-term investments. It's built for short-term crises and things that pay political dividends quickly. It underfunds things that take 20 or 30 years to show their benefits, even if those benefits are ironclad and provable. And this isn't a partisan issue. My opinion, it's more of just of a structural issue. So the solution is to identify a stream of money and separate it from the annual appropriation process by a hard dedication. The trick is to identify funding sources that are adequate, available, and which can be dedicated. Austin warned me that'd be too wonky, but the state has a prohibition on dedicated funds. Munis don't, just so you know. So municipalities can dedicate, the federal government can dedicate, and the state can, though they have ways around it. Okay, so that's dedicate the money, get it out of the normal appropriation process. Second, trust the people. Early on, we took notice of the fact that local voters in Anchorage, and really across the entire country, regularly approve bonds that increase their own taxes to pay for schools. Now just think about that for a second. We see of Anchorage as a high resistant to tax town, but they do that over and over. So use that. Don't be afraid of it. We embraced it, and so even if your proposal requires a public vote, even if it doesn't, you might want to put it up because it saves it from political pressure. Third, go where the kids are. Mixed delivery makes providers partners instead of potential opponents. More importantly, it serves more kids. Early on, we committed to mixed delivery in early childhood education. That means improving the capacity, quality, and affordability of pre-education in all the myriad multiple ways that it's currently being provided in Anchorage. Now, frankly, that's messy. Some pushed us towards a more centralized system with government pay rates, according to sort of European model. We pushed back and insisted on mixed delivery for a number of reasons. Some practical, that system costs more. Some political, Alaskans might not be ready for a Sweden system. But more importantly, we wanted to honor the ways that have been found. Alaska families need this service in a lot of different ways, and we wanted to find them where they are and improve them where we can. And that also allows, and it's really important to us to reach more kids. It allowed me to say to my progressive allies in the Assembly, yeah, the Anchorage Baptist Temple might get this grant if they meet the grant requirements, because I want to serve those kids too. I got a minute warning, so finally for build a broad coalition. Early, our polling showed generally broader and deeper support from progressives than conservatives on this issue. Conservatives were skeptical, more skeptical, and much more concerned about the fiscal impact. But it also showed that addressing those concerns head on and emphasizing the business case moved many of those moderate and conservative voters into yes. We had early support from prominent conservatives like Kevin Cross on the Assembly and my friend Fred Dyson from Eagle River. Because our funding mechanism moved money out of the general fund into dedication to this purpose, it created a fiscal hole in the municipal budget. And that was really important to our conservative allies that we addressed that. So we, for the first time that I know of, lowered the property tax by about $1 million. So it wasn't a one-for-one, but we did say, look, we're going to make sure that not all of the effect of this lands on property tax owners. And that was both an appropriate to keep our coalition together and ended up being a big selling point when we got there. So I'm out of time, but I would like to leave you with this. Many of you may be worried about aspects of American democracy or our local version of it here. I am. We seem stuck and divided. But when you ask the public to move forward, particularly where it helps kids, they often say yes. I'd urge you to develop plans to give them the opportunity to say yes.
Thank you, Eric. Very well articulated. I appreciate that. We're going to leapfrog here. Casey Warner, you are next. So if you can just share with us what work is happening in your beautiful community of Seward, please do.
Thank you. So I live in Seward. It's a small community just south of Anchorage. I kind of came into this work by accident. I was a home visitor in Seward. I served about 20 families in my community. During a lot of our home visits, I often heard childcare as one of the main barriers to my families being able to access services or provide for basic needs for their family. I got curious and did a town hall in January of 2020 where I launched a community survey to learn more about what was happening in my community. I had CCPO come down, Thread attended that town hall as well. We had great turnout to that town hall, and we also had great participation in our community survey. Through that, I began speaking to my local city council and other leaders in the community. COVID happened, of course. It put a highlight on childcare, which really then brought out that data to our policymakers. When the city of Seward was gifted some funds from the Norwegian Cruise Line to dedicate towards the economic recovery of our community, City Council had the groundwork. Our policymakers and our leaders understood the need for childcare and how that was a barrier to our residents. So they allocated some of those funds from Norwegian Cruise Line to come to Sewer Prevention Coalition. So that way we could start to address the childcare deficit in my community. Since then, we have been able to nearly double the licensed childcare availability in my community. We have continued to develop innovative programming to support that capacity as well as the quality of our licensed providers. I recently began working with our Kenai Peninsula Borough Assembly member advocate for childcare and looking at ways that we can support childcare throughout our entire region.
Great. Thank you, Casey. Very well done. I love the initiative and the creativity that's happening in Seward, and I commend your community for continuing on with this work. We're gonna reel it back in here. Robert. Robert, Juneau has been a leader for all of us with the city and borough's investment in childcare. Please share with us the latest efforts that you have underway in Juneau.
Thanks, Olivia. It's my pleasure to be here. You know, I think where I'll start is that the Assembly started really paying attention to childcare back in 2018 when it formed, the Assembly and the mayor formed a childcare committee. And as is the nature of committees, their job at first was to educate themselves, get research, and eventually, at the end of the day, their charge was to make recommendations back to the Assembly about what the community needed to do to address all of the problems that we were seeing in Juneau, all the same problems that we've been talking about today, that we still see and have been seeing for a long time. And really what that meant is that the Assembly was looking for recommendations from that group on how to allocate the community's resources, because at the end of the day, that's what your local elected leaders do, is they take in taxes and they apply those taxes to the community's priorities as they best see them. And I'll talk a little bit about the outcomes here in a second, but I think it's important to start by recognizing how that committee formed. It credit to our Assembly for sure, but work like that doesn't really take off unless you have a strong group of local advocates that are willing to do the hard work and make it easy for elected leaders and for government staff to make progress. And we certainly had that in Juneau and still do. A number of them are in the room today. Strongly, that work strongly was supported, still is supported by local organizations like our AEYC Southeast, who implement many of our programs, and Juneau Economic Development Council. They are here. Thank you for continuing to be such strong advocates and helpful in doing good work. I like to tell people in public that my job is to advise the Assembly and help implement their priorities, but really, the truth of the matter is that I have 50 things to do. I can do 2 or 3 of them. I can delegate another dozen, and the rest of them just don't get done. And the same thing is true for your local elected leaders. And I think if we want to make a difference in making childcare a priority, you have to make it easy for childcare to be one of those few things that they can make progress on. So anyway, that committee finished its work. It made recommendations, and we've been standing up programs ever since. And I'm going to talk about 2 of them for want of time, but there are others that I'd be happy to talk about as well off the panel or part of Q&A. It's also worth noting that the work of that committee is all available online. You can just Google Juneau Assembly Child Care Committee and it all shows up. But the 2 programs that I wanted to talk about, we call them our per child stipend and our new this year, our per employee stipend. I picked those 2 because those 2 represent the vast majority of the money that we spend in the sector. And the goal of both of those programs is quite simply to inject money into the sector, because as we saw in Stephanie's presentation and in Katie and Nolan's presentations, the model is broken, right? You can't pay people enough to maintain employees, and you can't charge parents enough to fix that equation, right? The model is broken. So our per child stipend program, this year, the numbers have been changing from year to year, provides $400 per infant or toddler per month to licensed child care providers, $100 for preschoolers per month, $100 additionally for any 0 to 5-year-old whose family qualifies and is getting assistance from the state of Alaska. Our per employee stipend, $600 per full-time employee per month, prorated for part-time employees. There's lots of details that I'm not going into for sake of time, but that's the gist of it. For the numbers, people in the room, I'll know you want context around that. So Juneau City is about, Juneau as a city is about 32,000 by population. So if you want to do the per capita math, all of that is funded by about $2.3 million this year. 1.3 of that comes from local taxes, property taxes and sales taxes. Some of them are dedicated, but not all. And the other one, this year and next year, I'm sure most, if not all of you, are familiar with the Child Care Innovation Grants through the state of Alaska, and that money is supplementing the program. So our numbers are bigger this year than they ever have been, thanks to that program. So it's a pleasure to do this work. It's a pleasure to work with you all. Thank you for making a difference, and looking forward to what comes next.
Thank you, Robert. It's always nice hearing a city manager speak on behalf of his city that he represents. You are extremely knowledgeable and extremely engaged in the work that you're doing in Juneau, so such a model for the rest of the state. Representative Cologne, there's been more conversation in the Alaska legislature about childcare than ever before. And please share with us about what you're doing at the legislative level.
Thank you. So I am a representative for District 11, which is South Anchorage, between Huffman and Abbott Road, all the way up on the hill. See a couple of my constituents here. So I'm new to the legislature. I'm not new to this issue. I had 4 children and been in Anchorage, or been in Alaska my whole adult life. But my husband and I, we started in the military, and we had 1 foster child and 3 of our own children, and then we ended up adopting the foster child. And I have like the whole childcare story for our family is probably touches everything that everybody's ever had to deal with. And ultimately, around the kitchen table, my husband and I realized that it would be best for me to stay home, because he made more and I wasn't going to work just to pay for childcare. So did my own in-home daycare, and so I have a story around that. But when I went to Juneau, this came up pretty fast. I didn't see, to me, it was workforce, it was about kids, it was a obvious fit for me. And so I presented HB 89, which now that I've been on the task force is a very small sliver of fixing a very small part of a larger problem. I am working on the bill, so we'll see, Commissioner Hedberg. So initially, like what it is right now is that it basically increases the availability of people getting childcare vouchers. It adjusts the income. It also steps down people off of the vouchers instead of just cutting them off if they hit an income level. And it also will adjust the vouchers to the actual cost of care, which is dependent on a study that's in works now. And so when I look at that, and we did amend it to give some tax credits to corporations who would provide daycare, and there's some things in there, but I think I've learned a lot on the task force on the issues around the licensing and around the workforce. So although I'm grateful, like the bill will increase access, what I'm hearing is that we need more childcare availability. And so I'll be working on that and trying to do some possible amendments to address that part of the problem as well. But the strange, I just have to address this, there's just been a weird thing that kind of caught me off guard when I started down this journey, is that I'm a conservative that wants to help with childcare. And everybody was looking at me funny, including my conservative peers, which I found really weird because I didn't see this as a partisan issue at all. I'm a mom of 4 kids. I've done childcare. I've struggled with that. Didn't even occur to me that that was a thing. And so as I kind of walked down it, this path, I appreciate what Mr. Croft said, and being able to grab bipartisan, if you want a bipartisan effort, you have to address those things that conservatives are concerned about, and that's mainly the financial part of who's paying, how are we going to adapt, where's the subsidy coming from. And so that's what I've been trying to do with my peers, just trying to talk to them through how this is so important to the economy, to the workforce, and to the kids. And also, how are we going to pay for it? Where's the money coming from? And they're slowly like understanding, like this isn't a partisan issue. This is something that affects everybody, every business, every family in some regard. And I've got some grandchildren, and they have grandparents are here to help them. But most Alaskans don't have that, which I think was mentioned before. We're a military family, and I know military families are away from extended family. So in the military, we would kind of, have each other's backs. But I think there's just sometimes people don't realize exactly how big of an effect a lack of childcare is in our communities, in our economy. And that's why I'm grateful that at the state level that I can be a part of the solution. But as been said before here too, is that it takes a lot of partners with the state, with the muni, with churches, with business. Everybody needs to play a part in the solution, and I'm just grateful that I can offer something to help.
Thank you, Representative Cologne. Sarah. Well, we sit here again. We were here in 2021. Thread has been following the work that's been going on in New Mexico for an extended period of time. It's exciting to see the work and the fruition of the labors. So I just want you to tell everyone in this room what you've got going on in New Mexico.
Okay, well, you have a great state and local leadership here, so I was like, you're good, I can go now. But for those of you who may be like, why should we believe New Mexico? I just want to tell you a few things about New Mexico. We're 50th, sometimes 51st, if you didn't think that was possible, in education, 50th in child well-being, and have the 3rd highest child poverty rate in the country. So I want to say, if we can do it in New Mexico, you can do it in Alaska, definitely. You can't get worse than 51st, so you can do it. If that didn't sell you, we're really similar. In fact, I actually learned someone I work with is from Alaska, and she said, New Mexico is like Alaska, but warm. So I'm gonna sell that to our award-winning tourism bureau, and if you see that as our new slogan. But our biggest industries are oil and gas, tourism, military. So we have a lot of the same funding to draw upon as you all, though I admit we don't have dividends. So that makes our job of distributing the money a little bit easier, but it's not impossible. So I know you've heard the New Mexico story, maybe ad nauseum for some of you, but for those of you who haven't, I really just wanted to tell you it. It is, I think, for the purposes of this childcare conversation, 2 things are important. That's the way we govern early childhood services in New Mexico and the way we pay for them. So in 2019, I think you got to see Senator Padilla and our Cabinet Secretary Elizabeth Gerginski last year, or the year before. All these years are kind of one year, telling you about how New Mexico established the Early Childhood Education and Care Department, which at the time of establishment was the 4th cabinet level agency for early childhood in the country. I believe now we are among 4 other states, so there are 8 of us total. Why does governance matter, and what do we govern? So we govern childcare licensing, and which is our regulatory side, as well as childcare assistance, early intervention and soon to be early childhood special education in schools, home visiting, early childhood nutrition programs, as well as some of our state summer food program. We have a perinatal health program. Basically, any program that seeks to impact children's prenatal to 5 health and development directly is under us. That for the childcare conversation, I think sometimes can feel like, why is that related? I think for some things it's more obvious. New Mexico has nearly universal pre-K for 4-year-olds. We serve 73% of 4-year-olds. It's not a means tested program in New Mexico pre-K, and about 25% of 3-year-olds. So you can imagine the impact on childcare, and the childcare budget of that is great. And early intervention, if children are not identified, we are number 1 in identifying children in the first 12 months of their life with a developmental delay or disability. If you don't get those services, for those of you who rely on that great data we saw before, those outcomes are not going to look as good if that service doesn't work well for children, not to mention that children deserve those services, and so do their families. So that impact on the childcare ecosystem is great. But I think the most important thing that I would say is right now for families, if you wanted to make grocery shopping really, really not fun, you would just randomize where things are in the grocery store. Maybe a good supermarket sweep episode, but it's definitely not a great way to set up services for families, especially when they have, when you're pregnant or when you have a young child and all of that stress, to not know where to go is huge. And I think of it like you only have so much energy, and you definitely have a lot less energy when you're being awoken every 3 hours or less by a crying child. And to govern services in a way where families know where to go when they need help, and when their children need help in that prenatal to 5 period, I think is game changing for families. And it's certainly game changing for public servants who are also people, believe it or not. So I know I'm going too slow here. So what I also want to highlight is dedicated funding. Eric talked about not having to go through the appropriations process every year. Last year, 70% of New Mexicans approved a constitutional amendment to allocate our land grant permanent fund, which mostly funds K-12, to early childhood education, giving us last year about $150 million annually, which will slightly grow over time. But we also have another trust fund that comes from oil, gas, and mineral rights, which this year distributed $140 million. Next year, I think we'll distribute about $289 million a year and grow from there. I will say to the legislators in this room, because we hear from our legislature, while you should be self-sustaining soon, it costs a lot to run an early childhood system, and we've never funded it in any state in this country. So we're digging out of a hole of disinvestment in this area, and it's not going to be cheap, and it's not going to happen quickly, and we will still need the regular appropriations process to fund some of this work. We need state general fund, and I think you will hear too. And so that's a lesson I would share, is that dedicated funding is incredibly important, especially for services. But without going through annually and getting those general funds, I highly doubt you have a funding source in Alaska that could fully fund the prenatal to 5 system in the way that families and children need it. But don't stop that from doing dedicated. Don't let that stop you from doing dedicated revenue. I just want to share kind of as an ending, and hopefully I can end on a testimonial from a family, because this can feel very abstract, but as you saw in your data, basically if you meet a family with a young child in Alaska, they're more likely to not be able to find childcare than likely to be able to. That was true in New Mexico too, and I'm proud to say I think it's much less true. We started funding based on the cost of quality. We fund about 98% of what it costs to do childcare for a provider. Your childcare providers are the ones subsidizing that right now. That's where those low wages come from. This industry is subsidized on the back of women who are doing this care. We don't do that in New Mexico anymore. Wages are great. We pay $1,900 a month for an infant in a 5-star center, and that is still not quite what it costs to offer care to that infant, and it's way more than any family could afford. We have no co-payments. To show you the impact, we serve 10,000 more children. We also increased our eligibility to 400% of federal poverty, which is 80% of New Mexico's families, but we still really serve families mostly from 0 to 200% in our program. They don't have a copay. That childcare is free for them. That means we serve 10,000 more children than we served 2 years ago in New Mexico in our childcare assistance program. That's incredible. That's game changing for families, and we're just going to keep going to make that a universal childcare system. That's what we need to stabilize the field, and that's what we need to make sure families have access. We're not perfect. We still have a lot more to do on supply, especially. We're right there with you in our rural areas, but really every area of New Mexico, we don't have childcare. I'm sure I'm out of time, but I'm hoping that I can just end with one quick thing, which is a testimonial from a family. Because again, I think that those 10,000 more children are real people that we see, we meet in the streets that may be us. And I was an English major, don't ask, but I would love to diagram this story to show you both that we've made government services better and more accessible. So a mom says, the whole process was really smooth, and the early childhood and education care department team worked with me throughout our application. Our interviewer was very kind and helpful, which gave me a positive first impression. The biggest impact for us is that I used to be a stay-at-home parent, but now with childcare assistance and the pre-K program, my husband isn't the only breadwinner. I've been able to fulfill a long-term dream of mine to go to nursing school and become an RN. I'm sure you, like us, we do not have enough nurses. Up until we enrolled in this program, there wasn't a way for me to financially afford going to school because of the cost of childcare. And because of New Mexico's childcare assistance program, I am now working towards my dream job. It's helping my dream come true.
Oh. Thank you so much, Sarah. That is so inspiring to hear stories like that. So again, I just want to give this panel a round of applause. They've shared some tremendous stories with us about the work that they're doing in their smaller communities across Alaska. I know we haven't had any village representation up here, but these communities are coming up with innovative ideas that some of us can grow in our communities and try and prosper and move forward with supporting our families and children. So thank you so much, panel. We will be opening up for questions from the audience. If anyone has a question in the audience, please raise your hand. We have a microphone. I know people love microphones. Just grab that mic, own it, just belly up to it. Don't be afraid. And if no one has a question right now, we have a question in the front here. So microphone, Tracy, hello. Tracy has the mic right here in the front.
Actually, I don't have a question, but I'm secretly adding in some of our tribal investment strategy funding comes out of that funding that was allocated by New Mexico taxpayers. And in this funding, it helps us to improve and support the 23 Pueblo tribes and nations in the state of New Mexico. And that's based on their priorities through tribal consultation, but also through working government to government. So I just wanted to throw that in there. We are at 2.25 million being allocated to our tribal communities, and that's really from growing from 1.75 to 2.25. So we're growing as well in that department. So I just wanted to share that.
Yes. And in my 3 hours of sleep, I forgot to introduce our Assistant Secretary for Native American Early Childhood Education, Cotillion Sneddy from New Mexico, who's joining me as well, the only one of her title and role in the nation. So Thank you for adding that.
Welcome. All right, any other questions?
While you're thinking of it, I mean, recognize the comparison here. So a very comparable state, New Mexico, to us, right? We thought we were absolutely unique, but in all the ways I've mentioned, and then just brought up a significant Native population with its own tribal rights. So a lot of similarities there, and they've done it. They have. That's the dream. 98% funding for very little provided by the other. So our sister state did it, and we don't think we can?
That is a good question. So this is a question for the whole panel. Work in progress to advance childcare change takes time and persistence. What have been key markers or turning points in where you saw progress in your efforts?
I guess I could grab that one to start. I would just underscore the time and persistence piece. And Sarah talked about this a little bit too, with the fact that we've been disinvesting in this sector for so long that it's not just something that you flip a switch on, right? We started making local investments in a meaningful way right when the pandemic started. And so do you think we saw a ton of immediate growth as a result of those local investments, or a lot of really positive results or outcomes out of that local investment? No, of course we didn't. But we did see stabilization happen during the pandemic. We didn't lose in Juneau. We did lose statewide, but we didn't lose in Juneau providers, and that's a success. So it's not what we were hoping for, but it's a success. And celebrating every little or potentially seeming little success is important. And keeping that light on the issue at assembly meetings and public is key.
Thank you, Robert.
And I would say for us, just the constitutional amendment that you heard me talk about that distributes our land grant permanent fund that voters voted on last November took over 10 years just directly, and that doesn't count the kind of indirect movement building that was happening before that. And it was an effort with a lot of childcare providers involved, advocates, legislators, the governor. But the reason it probably doesn't have to take 10 years. It did take 10 years, but it also meant that when a governor came in who had this as her priority, she could take up the mantle and move it very quickly. And so I look at the thread logo on this paper, and that reminds me of kind of what doing this work is it's not linear, but it takes the time it takes, and all of those milestones along the way. I would say just getting a failed bill, because those constitutional amendments have to be approved by the legislature first in New Mexico, and that was tried several times. And then, advocates went out and made sure people who were the holdup in the legislature had some competition and lost their seats. So there's a lot of different milestones, but I would just say every, piece of the work and every door knocked on and every conversation had and behind closed doors was not for nothing. And even though a lot of days it feels like that, I'm sure to many of you.
Absolutely.
So for me, it seems subtle, but it's a pretty big deal behind the scenes, is that the partnership with the chamber and the business community is huge. I worked the private sector most of my life, and that was always an issue, was childcare. And to have Katie Capozzi on the task force, to have business people call me and ask, what are some of the businesses doing, for the business community to be interested in it, I think they're a key to help solve this problem. But for years, they've always been kind of on the sidelines saying, well, it's your kids, you deal with it. And now they can't say that because they have vacancies they can't fill. And I tell business people all the time, if you want a loyal employee that's there at work, ready to work, help them with their childcare. And there's a lot of great options. They don't have to build a childcare center in their building, but there's a lot of things they can do. So for me, that's been a pretty big deal to see the business community be involved.
That's a really great point. I appreciate you bringing that to the forefront. I do, go ahead, Casey.
So in Seward, one of the biggest turning points for us was finding my champions for childcare within my city government as well as within my borough. I also kind of want to throw out that my first idea for addressing the childcare deficit in Seward did not stick. And so the persistence came in. And the second idea actually ended up being best in being able to provide funding for startup grants for individuals wanting to become licensed providers. We've since extended our program to an education stipend, which I looked at Juneau and their Hearts program for inspiration there. And with that pivot and that persistence in the way that we are going to address the childcare, we are able to provide more longevity in our funding that was provided, as to where the first idea of operating a siloed childcare center would have taken up the majority of our funds, would have only offered up 40 childcare center slots in my community, as to where we've already hit, we're nearly to the 40 licensed slots in our community with tons of funding left over to continue to grow.
Wow, thank you for sharing. Eric, did you have anything to add?
I guess, and I've been debating whether to do this, but I served for 10 years in the legislature and would have delegations come down advocating for these kinds of things, which I would support. In fact, I may have been doing this long enough, and some of you may be doing this long enough. Some of you may have come to my legislative office and asked me nicely to do things, and I would say yes and propose an amendment or a budget rider that usually got voted down. And I guess my point is you're being too polite. There's an old political story of attributed to FDR, but it's general, that he heard a pitch like that and said, "You've convinced me it's the right thing to do. Now go put enough political pressure on me that I have to do it." Sarah talked about unelecting some legislators that just weren't helpful on the constitutional amendment that they were trying to get passed. I think you've been, and I remember the faces very well, or the attitude of just sort of confusion about you're explaining a thing that is a great need, that has huge benefits, that like there's no reason not to do it, but you never put enough pressure on them that they had to do it. And again, I don't see it as a partisan issue. I see it sort of as it's responding to things that'll get them elected or unelected next term, not something that's going to be great in 20 years. And so that's why I emphasize dedication. Take it out of that process. Both had votes. I mean, Juneau has one of the most progressive and supportive assemblies on this issue ever, and yet they did a dedication, right? Even the Juneau Assembly wanted, if you didn't say this, but I did, some cover. So they said, we're funding at X, we want public permission to add 1%. And that's a legislative body that wants to do a thing but feels a little nervous whether they can. But when the public says yes, yes. And this isn't just in statute, well-meaning in New Mexico, it's in the Constitution. So look for mechanisms that get you out of that trap of being ignored by a well-meaning legislature or assembly or whatever.
I don't disagree with anything Eric said. It's all good thoughts, but I will say that our assembly just wanted another funding mechanism. They saw that vote not as political cover, although sometimes you need that. Like no disagreement there. But they were like, hey, like let's put this here too, so we can get more money to address the problem.
That's right. They have a kind of strange mechanism there, but they put it up as the thing. Yeah.
Yeah.
Absolutely. So we talk about the key markers and turning points in the work that you all have done in your communities and across the state. I'm curious, from a foundational point of view, we're going back to Maslow's hierarchy, that foundation. How do you get the public and business partners to understand the importance of childcare? And I'll let any of you take this and tell me what we need to do in Valdez to get everyone on board.
I have a fond spot in my heart for economists, so I might have a bias here, but like, I just want to show, like, Katie and Nolan's presentation, man, really? Like, come on, just watch it. Like, it impacts so many areas of our life and our economic future and our ability to maintain our population in the state. Like, do you need more selling points than that?
Get on the train, it's leaving the station. Casey, I see there.
In Seward, we have a really strong prevention coalition, which is the organization that houses the hyper program. And due to the work that our coalition has done in Seward and really being able to pull in a lot of our city government, our business sector, our nonprofit sector, there, I believe we're up to 140 members on the coalition. Because of that, I have a great platform to speak to all of them. So I really have to take my hat off to Seward Prevention Coalition and the work that they did to provide me with that foundation I needed.
So in my experience, a lot of people know the statistics. But the bad part about statistics is it can kind of dehumanize the problem. And so in Juneau, we did a lunch and learn thread, presented a lunch and learn and had a video made of someone trying to get licensed in rural Alaska. And so sometimes you have to kind of get that personal story. A lot of people understood, you can say, well, licensing, we have problems with background checks and the fingerprinting and the whatever. It's just a list. But when you actually watch someone's story unfolded on video of what they've had to do to get that license, then you understood, okay, this is a pressing problem. So I think sometimes just in those groups that you're talking to, if you can get that personal story out, it'll resonate with people. And that's why I start with my own story a lot, because you have to know that like I've struggled with the same thing. I get it, I understand. And so I think a personal story, especially when I'm talking to legislators, because they have so much information coming at them. I need something that grabs attention. That's usually testimony that's humanizing the issue instead of just the statistics.
Yeah, and I mean, I guess I would ask the question, I think we know so many people do care about the issue, so why aren't they creating that political pressure Eric talked about? And if we look to the New Mexico example, I would say the coalition that brought this over the line was not the coalition you might expect. They weren't traditional early childhood advocates. They were very much more community organizers. Not to say that there isn't a place for early childhood advocates at the table, because there absolutely is, but I think getting out into communities, people care about issues, but they don't have time. I mean, they're looking for childcare and they've got other things taking up their time. We need some of those folks who know about movement building and organizing to be at the table to create that political pressure. And you all certainly know your own state context and what that might look like in Alaska, what that looked like in New Mexico was really community-led organizations who were really from that community, who had connections with both families and providers, being the lead, and other people stepping aside to let them lead that conversation at that time.
Thank you for sharing. Does anyone else have anything else to add to that question? Because I think we have a question from Bethel. So do you have a microphone?
I'm not with Bethel, but
Oh.
I love Bethel, great community. I'm
Oh.
Thomas, I'm the Executive Director of the Alaska After School Network. Today's Lights On After School, which is also a great reason to celebrate licensed school-age childcare. So one of the things that we know that's been happening is, since the pandemic, we've lost over 30% of all of our licensed school-age spots inside of the state. So frequently, a lot of municipal efforts or other funding efforts are looking at our youngest kids, which is critical. We agree, birth through 5, critical, important time. But we know so many of our families need continuum of care going through that school-age child. Would really love to hear from you all on how do we expand and advocate so that the message resonates that this is a continuum of care that families need, that children need, especially for our children that have disabilities and families that have other factors going on. How do we advocate to make sure that the message is not just, great, if you're under 5, we got you covered, but once you hit 5, get yourself home, kid. How do we advocate for that, knowing especially in Anchorage, where we're having a dramatic change next year to our school year system, that it's going to decrease our number of care spots again. And Juneau has been struggling with keeping Raleigh, their licensed school-age childcare provider, open. Seward has faced ongoing challenges with funding Boys and Girls Club and other programs. Would love to hear your thoughts on how do we make this, and policymakers in our communities understand care doesn't stop at 5, that it continues through the continuum.
That's a really great question. Does anyone want to field that one?
I mean, I will say, even when you do focus on birth to 5 school age is our most rapidly growing licensed population. We have thousands more school age slots after the pandemic than we did before the pandemic. We have a lot more families utilizing childcare assistance for school age care. And so I don't have a great answer, and certainly not a localized one, but I think that that kind of a rising tide lifts all boats certainly has applied in New Mexico to school age care and focusing on the prenatal to 5 system.
I don't know, maybe advocacy, but a little bit of what Seward has done. The city of Seward has had dedicated funds to a school-aged after-school program, which just a few years ago, they did shift that over in supporting Boys and Girls Club. So Boys and Girls Club is our primary after-school program. I also want to point out that under Seward Prevention Coalition, we have an additional program called Youth 360 that focuses on those school age and providing structured and positive leisure time activities. And they've been partnering with Boys and Girls Club quite a bit, as well as our business sector, and being able to provide week-long camps, summer camps, and different structured activities.
I'll just add one thought. So demographic shift is real. We've heard about demographic shift already. Declining enrollment is part of that. Communities hate closing schools. Politicians, therefore, also hate closing schools. So the more that we can do to utilize school space as it becomes more and more available, the better we are.
Yeah, a good reminder for us. I mean, part of the challenge of doing one good thing is people bring up other associated good things you could help with, and you know, it's appropriate, but the money can't necessarily solve all of it. We were thinking originally just 1 year of pre-K is what we were going to fund with this, and then childcare has to be part of that discussion. And you're right that ongoing care after school needs to be part of the discussion too. There was a concern that this money wasn't enough. I was born here in Spenard, and I have a great deal of confidence in the people I know in the community and don't know in the community to consume marijuana products in the future. And so I convinced people that I think this, and as well, part of the deal we made with the marijuana community, right, which has a business association now, which is kind of funny, and they're like low taxes, and well, you were a felony 5 years ago, so the original deal they've set up was the tax could be anywhere from 5 to 12%, and it's stayed at 5%, but it could go higher. And we, as part of the deal with them, said, okay, we'll freeze your tax at 5% for 5 years, not forever, and we'll lower the potential maximum tax from 12 to 10. But anyway, we can still do 5, and I was open with them. After 5 years, I may come up and say it should be 6 or 7 or 8. That's just the deal you're making. You get something, we get something. And but so I guess I'd say that this fund will grow. Will grow with the sales of marijuana, and I intend probably for it to grow with an increased tax rate. And so I think if we are careful with our money and leverage it well, and I see Kelly's here and Carl's here from the school board. School board's been a great partner. We intend to be tough negotiators with the school district and say, you're going to provide facilities, and you're going to provide, and we'll provide help with a new teacher or these things. I guess the answer is you're absolutely right, a good reminder, and we think these things that we have can be stretched somewhat to provide that kind of assistance.
Yeah, thank you for those answers. I will just say in Valdez, our task force, and I hope that I can articulate this properly for the task force as a representative, we have oftentimes thought of ways that we can almost connect the two. How do you engage that after-school population into potentially the early childcare workforce? So how do you bring them in and maybe have internships set up so that you can teach them how to care for small children and then set up programs through your community colleges that allow you to get an associate's degree before you even graduate from high school in early childhood education. And then how do you connect that with the university programming that we currently have in the state? So on a broad, long-term thought, I think your question is right on point. Our children don't stop growing after the age of 5, but how do we connect all of this work on the whole spectrum that allows us to not only create more robust programming, create a professional industry around early child care education, and then continue to have that work stream pipeline in place. And I like your question because it brings that to my thought process. So thank you so much. Are there any other questions in the room? Okay, we've got one. Microphone en route.
Thank you. I think it's been shown that childcare availability can put families in poverty or take them out. Has a line been drawn between the impact of childcare on rates of poverty and the resulting cost of social services down the line? Or was that useful in New Mexico? Has anyone found that to be a driving factor in support for childcare?
I think I would say some of the economic participation, workforce participation things were helpful. People's real experience was helpful. There's probably other, better researchers in the room, but I do think we have a childcare research problem. The research that's being done isn't being maybe elevated to, or translated to be widely understood by those of us who don't remember statistical significance and those kinds of things very well from our grad school days, or who didn't ever get that experience. And then, just on this note, it's not what you asked, but I think the impacts of childcare, we could learn from other countries, or we could do some better messaging both on that kind of long-term impact side as well as the impact on children. I mean, I heard a lot of that this morning, which is heartening and unsurprising for me from knowing Thread that is brought into the room. But one thing we are still struggling with in New Mexico is getting our legislators to understand that childcare is education, just like pre-K is education, just like K-12 is education, especially at the infant toddler range. I mean, that's where infants and toddlers are going for out of, home care. And yes, we have underfunded it and the quality is low. And so I think that's where some of all of the research maybe shies away a little bit, is when you aggregate childcare, maybe the effects are diminished a little bit because we've underfunded it. And so it's hard to prove its efficacy, but I could make no sense on this topic for a long time. So I'll just say no. I think that it was really about elevating the impact on real families in New Mexico that changed people's hearts and minds, and demonstrating how much the voters wanted childcare, even though the legislature may feel like their vote was more of a pre-K vote, even though it's clearly a childcare vote. But we have a long way to go, I think, as a field, and certainly in New Mexico, about talking about the long-term impacts of childcare on children and their families.
Yeah, and I know as a nurse, the adverse childhood event studies that have been done regarding childhood trauma from the age of 0 to 18 have shown that people who are exposed to trauma, i.e. a lack of support, a lack of resource, have higher incidence of chronic disease conditions like diabetes, cancer, heart disease, depression, substance misuse. That study was done in 1990 by the CDC and Kaiser Permanente, and it's a rather robust longitudinal study that really has very good data associated with adverse childhood event scores, and it even delved into recidivism with prison rates. So there is research out there. I would encourage all of us to become more highly engaged with research and figure out ways that we can set the tone that this work is so important to our society as a whole, and engaging people into the workforce and our economy.
Yeah, the ACEs research that you were talking about, I mean, that was the big surprise to me. And there probably are people out there who are experts in this, or a lot of knowledge of the research out there, I'm sure. But the surprise to me was there's still a fair amount of conflict about how long the educational benefits last, and it depends primarily on the quality of the pre-K program, right? Less intensive ones or less high-quality ones, maybe the educational boost you get from it doesn't last very long versus really high-quality ones does. So that, there's fighting about in the thing. What's crystal clear is what you said, that there are health and staying in school and staying out of jail benefits that are just significant and long-lasting, and every study shows those. So I thought there would be solid educational and maybe health. I didn't really think health would be a popper on that. What it says, and the latest research I think is moving towards, ACEs have this horrible effect on children, but having a safe place to go where people care about you can cure a lot of ACEs. It doesn't get you back whole, but it can do a lot more than maybe we would have thought at first to take somebody who's had horrible situations and now they have somebody who cares about them and it's safe and they can just read or eat or whatever. And so kind of coming back around to that question, it has huge health benefits. And we think if we do it right, educational benefits, but it's almost more important for what it does in other areas.
Absolutely. That was a really great question. I appreciated that. Thank you so much. Did that help? Okay.
Yeah.
Absolutely. We do have a question over here, and then we have one up front here as well.
Thank you. Sarah, you talked about access and affordability things. Do you have anything on how it impacted the workforce?
Yes and
Yes,
no.
she does.
I do. Unfortunately, we don't have a robust data collection mechanism yet for workforce data. We are building a workforce registry, and so I can tell you about a subgroup that we used federal COVID relief funds to kind of get a start on through what we called competitive pay for professionals, which was a $3 an hour raise for any program, regardless of who they were serving, that applied. And our average wage at the beginning was $12, and so it moved most people's wages to $15 and above. And we haven't truly seen the impacts on turnover yet, but it drastically, I think we look at folks in the program, and most all of the educators in that program, for the 2 years the program ran, we're getting that payment, which shows us, that is one indicator of turnover being drastically reduced. Our surveys told us everything from there's drastically reduced stress to people could do things like buy a car, have a wedding, just do normal, human things that we all want to do. So we don't have great research yet. I think it's lagging a bit, and we'll get there. But I think from all of what we heard from that program in particular, which did end, but our childcare, that cost of care study I talked about, does assume that all lead teachers, regardless of quality level, would receive $20 an hour as their wage. We give programs enough to do that as long as they're serving about half of children in childcare assistance, which is most of our programs in New Mexico. So that's a long answer to say I think we have some really bright spots, and I think we'll be able to show even more of that soon.
Thank you for your question.
Yeah, I just wanted to mention a couple things. I think one of the best examples of the long-term outcomes of early childhood is the Head Start program, to be honest with you. And I know that it's been put out there for a very long time, the fade out issue, but the big studies of the Head Start program show that children arrive at school on a par with their peers. And I always want to make clear that if the fade out occurs between kindergarten and third grade, that's a school problem, not an early childhood problem. And we get blamed for something that we're not accountable for. More importantly than that, there's a new study out of the EduCare program in Tulsa, Oklahoma, that everyone should look at, because it's a randomized controlled study of infants in poverty level parents. And it shows that those children at the third grade are still operating on or at their peers. And it's early childhood, it's birth to 3, which is very important in terms of what we need to know about the birth to 3 program. So, yeah, I just feel like every time I hear that there's no studies. There are studies.
I
but
didn't say
they're-
no studies. I said there's conflicting, but I totally agree with you. I think the better ones do that, yeah.
And I guess maybe a more articulate thing for me to say is in New Mexico, we've had a very hard time with people equating childcare with Head Start or pre-K. They believe pre-K works, they believe Head Start works, they believe childcare is something different. So that'll be a lesson learned. Don't do whatever we did to make that happen.
Are we? Okay, well, this was a really interesting panel discussion. I learned a lot from each and every one of you. Sarah Mickelson, Julie Colomb, Casey Warner, Robert Barr, and Eric Croft. Thank you so much for your time today, and I appreciate the audience participation. You did wonderful.
Thank you.
All right, well, everyone, we've arrived at break and lunchtime, but I have some instructions before everybody goes. So lunch is designed to be eaten during the next session, which starts at 11:35. We're landing this one a little bit early, so we've got some time to get people through the line, but next session starts at 11:35, so please try and be back in your seats at 11:35. Want to thank everyone. That was a great panel. There's 3 things that I took away. I mean, it was, 1, leadership matters, right? Leaders matter. And so I also believe that everyone can choose to be a leader. And what does it take? It takes, number one thing it takes grit, right? It takes staying in the game and being persistent to lead and to put yourself out there. And that takes grit and bravery. And so we know that a lot of these changes takes a lot of grit. Bipartisanship also matters, like finding a way to address the needs of and concerns of those across the aisle, whatever part of that aisle is, that also matters. And the last thing that really stuck with me is businesses coming to the table. If you remember how many people have been here since the first summit? How many people have been here since the first summit? How many business sponsors did we have for the first summit? Is there anybody here from Credit Union 1? Okay, Credit Union 1 has been with us, I think, since the beginning. And when we started, it was like, we talk about businesses, it was crickets. Except for, I think, maybe Summit 2, we had Credit Union 1 come and talk about their daycare. And that was the level of business engagement that we had. And now look at the back of the sponsorship list and the number of private, for-profit institutions that are now coming forward. So is there anybody here who is from the private sector? Like, I'm from the private sector. Anybody else here, private sector folks? Yeah, right? Like, we actually now have private sector people in the room. And so for those of you who've been with us a while, thank you. For those of you who this is your first, welcome to the revolution. But it's true, if we're gonna make change, we have to get the private sector involved. And part of the change that we're seeing right now is that the pain is there for the private sector to be involved. And so how do we capitalize on this? Because now they figured out that it matters. So we need to build on that as we're going forward. All right, with that, lunch is available in the back. We've got drinks, we've got lunch, we've got desserts. See you in 20.